Hello, my name's Fiona and I'm a critical care practitioner in the cardiac intensive care unit. I'm going to talk to you today about how the patient will present to you when they come back from theatre after their cardiac surgery. So this is how a patient would normally look after their operation. Every bed space in our unit is set up exactly the same, and the patient comes back with the same equipment and same tubes and monitoring. When they come back from theatre, they're kept asleep with this medication which keeps them asleep, and they have a tube in their mouth which is called a breathing tube, and this is connected onto a ventilator or breathing machine. When they're more awake, this breathing machine will come out, but initially it's needed just to help with their breathing. When patients are in the anaesthetic room, they have an arterial line inserted which is connected up to our monitor and gives a continuous reading of their blood pressure, and also we can take blood samples out of it. They'll also have a drip inserted, usually into their arm, just so that we can give fluids or blood as required. When the patient's asleep after they've had an anaesthetic, they'll have a central line inserted into their neck, and this is attached to all the drugs and infusions that we're giving. And they also get a catheter put in at that stage as well. All patients have these chest drains in, and these just drain off any blood in the chest that we don't want to collect there, and it's drained into a bucket which you'll see on the floor. They also have these pacing wires which are connected to a pacing box, and this just keeps their heart rate normal and steady. These are the drugs that they're getting all the time, so the white one is the drug that's keeping them asleep, and then we usually have a painkiller as well all the time. So when our patient starts to wake up a little bit and they're appropriate to us, that they're not bleeding or anything, then we can wake them up, remove this tube and put an oxygen mask on. At this stage, if you're present, we'd usually ask you to leave the unit while we take the tube out and make the patient comfortable. So this is an oxygen mask on that we have now that we've taken out that breathing tube. And at this stage, the patient can put their own dentures back in, or hearing aids, or glasses, or whatever they want on to make them a bit more comfortable. They'll also be provided with this patient-controlled analgesia, where they can press this and administer their own morphine to keep them comfortable. At any time, every patient has their own nurse by their bed space, 24/7. Critical care practitioners like myself are always available as well, 24/7, to answer any questions. And when we're happy with the patient that they're stable, they can either be transferred to the high dependency unit or to the ward, depending on where there's bed available.